what is endometriosis, if you don't mind?
Yeah. Endometriosis is basically a gynecological condition where the inner lining of the uterus grows outside the uterus. So like how we have a period every month, we bleed out, so what happens, the endometriosis sitting outside the uterus also bleeds. And there's blood collecting there. That causes inflammation, that causes scarring, so that causes pain because there are nerves involved in that. There's inflammatory markers released. So how that impacts a young girl today or a woman is when during that time of the month they have pain, and the pain is so bad they cannot go to school, they cannot go to college, they cannot go to work, they cannot do their routine activities. So it's like 4 or 5 days out of the month they are out. Yep. So over a period of time that amounts to a lot of number of days. So with endometriosis the aim is to try and treat it, to get rid of it. So when we know that she might be suffering with endometriosis and we go in to treat it, the aim is to get rid of the whole disease process. Otherwise, removing half the endometriotic deposit, leaving half of it behind is not going to help because there's half still left behind. It's still going to cause symptoms. So the aim is to take as much or all of it out. With 3D technology, which is we find in robotic surgery, we can actually see the depth. We can see how what we see on the surface is like the tip of the iceberg.
Correct.
The endometriosis is actually deep within the tissues, within the tissue planes, and that's what the robotic surgery or the 3D vision actually helps us define more precisely, more accurately. So we can. So treatment is complete. Cure is, complete.
So